Welcome back, friends, to TV5 News at 9. Joining us this morning is Dr. Brian Ye. Thank you so much for being here. Doctor, how are you?
I'm doing well, and you?
I'm doing great. Thank you so much for calling in. Today we are talking about lymphoma and proton therapy. So, doctor, can you first tell us and explain to us what is lymphoma?
So, lymphoma is a type of cancer of the lymphatic system. We have the lymphatic system because our blood vessels leak water. They leak liquid, and that liquid that leaks out of our blood vessels needs to be brought back to the blood. So we have this thing called lymphatic system, which are a system of lymphatic vessels and also lymph nodes that essentially collect fluid that's left with the blood vessels back from the tissues to the heart. And so lymphoma is a cancer of sort of the cells and of the lymphatic system. Now, in the lymphatic system, we also have our immune cells, which is why sometimes we have, like, for example, when you get an infection, you might have a large lymph node. The reason why is because the lymphatic system is, in addition to bringing fluid back to the heart, it's also like a great surveillance sort of system. It's constantly collecting fluid from all the different parts of our body. And in the lymph nodes, we have actually immune cells, which are examining sort of the fluid that's collected to see if there's an infection that needs to be, addressed, and so on. So lymphoma is a cancer of the immune cells within the lymphatic system.
Oh, thank you for that explanation. That really helps out. So, doctor, are there certain people at greater risk for this type of cancer?
There are, although we don't really know the exact causes. For example, men are at a slightly higher risk than women to develop lymphomas. Also, we know that people who have a family history of lymphoma within their families. It means they have a family member that has lymphoma, they're at an increased risk of developing lymphoma as well. There's also certain infections with certain viruses, such as HIV, or another virus called Epstein-Barr virus, that can increase a person's risk of developing lymphoma. Also, patients who have patients who are immunosuppressed. For example, patients who have an organ transplant and need to take immunosuppressive drugs, they're also at an increased risk of lymphoma. We don't know the exact reasons why, or there's a particular gene that increases a person's risk of developing lymphoma. We do know there are risk factors.
Yeah. So doctor, are there certain things we can do that cause lymphoma? I know a lot of people like to know that.
So as I mentioned to you earlier, there are certain viruses like HIV or Epstein-Barr virus. So obviously, for example, with HIV, we do know that it's transmitted primarily, through sex, but it's also being transmitted through, in the United States less so, but through, like, for example, blood transfusions and so on. In the United States, we've gone to great lengths to make sure that our blood supply is very, very safe. But of course, practicing things like safe sex are very important to avoid, getting HIV. So there are things, such as just, trying to protect yourself, that can decrease one's risk of developing lymphoma. There's other things. For example, smoking is, there's a small smoking risk with lymphoma as well. So there are things, for example, just practicing safe sex and not smoking that can reduce one's risk of lymphoma.
Yeah. Now, doctor, why might proton therapy be a good treatment option for some patients?
So we have lymph nodes throughout our body, and so lymphoma can arise anywhere where we have a lymph node. So depending on the location of where the lymphoma arises, sometimes proton therapy can be advantageous because proton therapy is a more focused form of radiation therapy. It's safer. It delivers less radiation to the rest of the body. So actually, I'll have a slide here I'll share right now. This is a picture of a patient with lymphoma being treated with 3 different types of treatments. Now, the one in the middle is the proton therapy. The one on the left and the right are 2 different types of X-ray therapy. The one on the left is something called just sort of like 3D. It's very, very basic X-ray therapy where we're just basically using a beam from the front and a beam from the back. On the right is a more advanced form of X-ray therapy called IMRT, where we're using multiple beams of radiation to really try to get that radiation dose where it's at. So this is a patient, you can see where there's this little red area drawn in this red line. That's what the lymphoma is. Actually, right behind it, this area is the heart. And so obviously we want to treat the lymphoma while it's giving as little radiation to the heart as possible. You can see here with the proton treatment in the middle, the radiation is really focused just on that area the lymphoma is, and the heart gets very, very little radiation. With both forms of X-ray therapy, you can see that the heart gets more radiation dose. With the older form, this is called 3D form, you can see the heart gets a lot of this red. The red is sort of the red shading, or that red coloring is where the higher dose of radiation is going. So you can see here, actually, the heart is getting all this red dose, which is very, very high. With IMRT, you can see that's less. There's also that red shading in the heart area. But here with protons, as you can see here, there's parts of the heart which actually are getting no radiation. So proton therapy is very, very good for treating lymphoma, especially when it's in a very sensitive area, such as close to the heart.
Yeah, we can see that proton therapy is really targeted on that lymphoma. Thank you for that slide. That really helped us visualize it. How can patients find out, doctor, if proton therapy is right for them?
So the best way is just give us a call. Our phone number is 1-855 on my Proton. That's MYPROTON. Or you can go to our website at mclaren.org/proton treatment. But we have nurse navigators who are available to speak with patients and to help them find out whether or not proton therapy is the best treatment for them.
Oh, perfect. Thank you so much for this information that you called in to give us today. We appreciate you, doctor.
Oh, no, thank you. It's my pleasure.
Of course, you're so welcome. You can find out more information in the hot link section at WNEM.com.